My name is Rae-Ellen Kavey. I'm a professor of pediatrics in pediatric cardiology. I'm in charge of our exercise lab and in charge of preventive cardiology for our division. This month, the National Heart, Lung, and Blood Institute released new guidelines for integrated cardiovascular risk reduction for children. And these are something that's been in development for several years and are directed at primary pediatric care providers. I think the reason the guidelines were developed is multifold. First of all, there's now a tremendous amount of evidence linking the risk factors in childhood to actual evidence of heart disease in adult life. And then at the same time as that evidence has developed, atherosclerotic heart disease remains the leading cause of death in the United States and in fact in the world. And then finally, we have evidence that risk reduction can reduce risk. So all of those things would say that guidelines are needed. The guidelines address all of the cardiovascular risk factors, but they have been distilled into a one-page review that I think many parents could benefit from because it has the risk factors tracked on the left and the ages of children across the top. So if you're taking your 5-year-old in for a clinic visit, you can look and see what are the risk factors that should be addressed in a 5-year-old. So it's helpful in that sense. It really orients both pediatric care providers and families to what the risk factors are and the ages when they need to get attention. The other thing is that there are certain changes that are specific to these guidelines that have not been addressed before. One is the use of fat-free milk as the ideal beverage for children beyond age 2. That was something that was not clarified in previous guidelines, and since the previous release, there's a tremendous amount of information showing the safety and the benefit of low-fat milk for children. And then the second thing, then, this is what has gotten a lot of headlines, is the recommendation from the panel that all children be screened for their cholesterol when they're around 10 years of age. And the reason 10 years of age was picked is because that's an age before puberty. During puberty, all lipid levels vary a great deal, so it's not a good time to test. Age 10 is a time when kids have a major pediatric visit as part of their routine, and the levels are stable and predictive of adult life. I think that's a big recommendation from the panel, and it's an important one. We know that 1 out of 2 children who have a high cholesterol at age 10 will have a high cholesterol when they're in their 20s. So the primary treatment in childhood is simply lifestyle change in diet. The primary treatment in adult life is drug treatment. So modifying that risk in childhood may mean that it will not go on to be a risk in adult life. And then there are major recommendations about activity, and these are not new. These echo recommendations from the American Academy of Pediatrics, but I can tell you when I see children, these are things that are not actually being accomplished, and they certainly contribute to the obesity epidemic, and that's the activity recommendations. At least 1 hour of activity every day of the week, with moderate to vigorous activity 3 days a week, and limiting leisure screen time to less than 2 hours a day. The whole idea of exercise has changed, both for children and for adults. I know when I was growing up, my parents didn't do anything. They were adults and they didn't exercise. And we didn't exercise either. We went outside and played. That whole concept has changed. And now, as adults, we formally exercise. We go and work out. And children even go and work out. And the whole concept of just being generally active has changed because many of us spend so much time sitting down in front of a computer or sitting down in front of the TV or just sitting down. The guidelines have a lot of specific suggestions in them, and here's one: no TV in the bedroom, period. That goes for children and for adults, although I'm not making recommendations for adults. And the second thing is that activity doesn't have to mean going jogging or going to the gym. It can be just playing around in the snow. It can be the Wii Fit, some of those Dance Revolution games, things that are available in the house. So if parents are active, children are active. That's the way the family is. And that's the very first recommendation in the guidelines in terms of activity. It is that parents serve as role models for their families. And that general activity rarely means when we're an adult that we're going out and playing soccer with, a whole team of friends and opponents. It means that we're doing something in a general way to be physically active. There's every reason for the parent of a child who's overweight to take action now, because it's much easier for children to change their lifestyle and to lose weight and grow into their weight than it is for them to become obese adults. And we now have a lot of evidence that children can lose weight and can improve their weight for height disproportion very significantly with the help of programs like the ones that I'm involved with. It definitely can change.